Eye diseases that cause blindness. There are several eye diseases that affect different structures of the eyes, but not all result in blindness. Diseases that result in permanent loss of vision only affect three structures. These structures are 1. The retina, 2. The optic nerve, and 3. The brain. Let us examine the diseases that affect these three structures. The retina. Some common diseases and conditions affecting the retina include 1. Age-related macular degeneration, AMD. This is a chronic and progressive disease that affects the central part of the retina, macula, causing loss of central vision. 2. Diabetic retinopathy. It occurs due to damage to the blood vessels in the retina caused by diabetes. It can lead to vision impairment or even blindness. 3. Retinal detachment. The retina detaches from its normal position and may result in blurred vision, floaters, or a curtain-like shadow over the visual field. 4. Retinal vein occlusion. It occurs when a vein carrying blood away from the retina gets blocked, leading to sudden vision loss. 5. Retinitis pigmentosa. It is a group of inherited diseases that gradually cause degeneration of the retinal cells, leading to tunnel vision and night blindness. 6. Macular hole, a small hole or breakage in the center of the retina, often leading to distorted or blurred vision. 7. Retinoblastoma. It is a rare childhood eye cancer that originates in the retina and can result in vision loss if left untreated. 8. Retinal artery occlusion. It occurs when an artery carrying blood to the retina becomes blocked, leading to sudden and severe vision loss. 9. Macular edema. It is the swelling of the macula due to the leakage of fluid from blood vessels in the retina. It can occur as a complication of various eye conditions. These are just a few examples, and there are several other less common diseases and conditions that can affect the retina. It is important to consult an eye specialist for an accurate diagnosis and proper treatment. The optic nerves. Some common diseases and conditions that affect the optic nerve include 1. Glaucoma. This is a group of eye conditions characterized by damage to the optic nerve, often caused by high intraocular pressure. It can result in peripheral vision loss and, if left untreated, can lead to permanent blindness. 2. Optic neuritis. It refers to the inflammation of the optic nerve, often as a result of autoimmune disorders such as multiple sclerosis. It can cause temporary vision loss, pain, and reduced color perception. 3. Optic neuropathy. It encompasses various conditions that damage the optic nerve, leading to vision loss. It can be caused by factors such as ischemia, toxic exposure, infections, or hereditary factors. For optic disc drusen, it is a condition where calcium-like deposits accumulate in the optic nerve, affecting its function. It can lead to visual field defects and an increased risk of developing other optic nerve disorders. 5. Papilledema. It occurs when there is swelling and increased pressure around the optic nerve, often due to conditions like intracranial hypertension. It can result in optic nerve damage and visual disturbances. 6. Leber hereditary optic neuropathy, LHON. It is an inherited form of optic nerve atrophy that primarily affects young males. LHON leads to a gradual loss of central vision in both eyes. 7. Tumors. Certain tumors, such as optic glioma or meningioma, can develop in or around the optic nerve, causing vision problems and optic nerve damage. 8. Trauma. Injuries to the head or eye can lead to damage to the optic nerve, resulting in vision loss. These are some notable diseases and conditions affecting the optic nerve, but there can be other less common ones as well. Early diagnosis and treatment are important in preserving vision and managing these conditions effectively. The brain. Blinding diseases caused by the brain are typically related to damage or dysfunction in the visual processing centers of the brain rather than directly affecting the eyes themselves. Some examples include 1. Homonymous hemianopia. This condition is caused by damage to the visual pathways in one side of the brain, resulting in loss of vision in the corresponding visual field of both eyes. For example, damage on the right side of the brain can lead to left-sided visual field loss. 2. Cortical blindness. It occurs due to damage to the occipital cortex, the part of the brain responsible for visual processing. Individuals with cortical blindness may have intact eyes and functioning optic nerves, but they are unable to process or perceive visual information. 3. Anton syndrome. Anton syndrome is a rare condition in which individuals with cortical blindness deny their visual loss and may confabulate or construct false visual perceptions. For achromatopsia, achromatopsia is an inherited disorder that causes total or severe color blindness, poor visual acuity, and extreme light sensitivity. It is caused by dysfunction in the visual processing centers of the brain. It is important to note that these conditions affect the brain's interpretation and processing of visual information, rather than being directly caused by the eye's th. Proper evaluation and diagnosis by healthcare professionals, including neurologists and ophthalmologists, are necessary for accurate assessment and management of these conditions.